I wanted to go through a quick overview of some of the common abbreviations for routes of administration and the number of times that you're giving medication that might make it easier when you're reading children's prescriptions and understanding how and when medication should be given. So some of the common doses are OD, once daily, BD, twice daily, TDS, 3 times daily, and QDS is 4 times daily. Now, some medicines are to be given with food, some medicines are to be given without food. And very often it depends whether that medicine absorbs through fat or it prefers an empty stomach in order to get the best absorption into the bloodstream. So all the time what you're trying to do when giving medication is to get the optimal dose with the smallest number of side effects and just balance it. Now, drugs have a half-life, which is the amount of time it takes to be broken down, and that depends on sort of how long it will stay in their body as well. And different routes of administration make a difference as to how the easiest way to get the maximum absorption, if that makes sense. So an awful lot of medication is given orally. So it might be given orally in a liquid or orally in a tablet. Sometimes it's given sublingually, which is under the tongue, like a GTN spray, and that gives you much faster absorption straight into your bloodstream. Sometimes it's given rectally, such as rectal diazepam in seizures. That goes very quickly into the mucosal membrane through the rectum and into the bloodstream, but obviously if somebody is having a seizure, you wouldn't want to put anything orally because they would choke on it. So the other way when someone's having a seizure is that you sometimes give it as Buccal Midazolam, which is when it's rubbed into the gums. Again, similarly to sublingually, it goes very quickly into the bloodstream. And if someone's having a seizure, you can get to rub that into the gums without risking being bitten or without them choking. Sometimes it's injected, and it depends what you're trying to achieve or the best way for it to be absorbed as to how it's given. So subcutaneous injection is a little needle, and it's given just under the area of the skin below the dermis and the epidermis, and that's how you give diabetic injections. So insulin is given subcut, and usually quite often that's given in the tummy or in fatty areas. Adrenaline injection, so an auto-injector, so any one of these, would be given straight intramuscularly. So it's a slightly longer needle and it goes straight into the muscle. Again, that's the best way for these to be absorbed. In a school environment, you would never be giving anything intravenously, not without a huge amount of training. With creams, when you're rubbing those in, make sure you wear gloves, because obviously you're rubbing it into the skin. It's an ointment or a cream that will be going into their skin and rubbing the medication. If you're not wearing gloves, you will be absorbing their medication. And you know, over a period of time, you'll be getting quite a substantial amount of it. So always wear gloves. Eye drops, you'd use a separate eyedropper for each eye, and they should be labelled left and right. Nasal sprays are always for individuals, and your inhalers, in a school environment, it's the blue one that is your reliever inhaler. It's brown, purple, green, and whatever colours they have. The other ones are likely to be preventers, usually quite steroid based. And if you're able to give them, if they have a spacer device, then the spacer device means that it will go far better. It has better absorption into their down into their airways rather than it hitting the back of the throat. So spacers, if they have one, they should be using them. As a school, if you have a child who has been prescribed an asthma pump, or they've been prescribed an auto-injector, as a school you're allowed to have and carry a spare one, an emergency one, and there are separate paperwork and information about that can be found on our website.